Good morning, everybody. My name is Henry Liu. I'm here on behalf of Hoag Hospital. It's a cold morning in Newport Beach. We're glad you're here. Sit back, relax, have a warm cup of coffee, and we're going to share with you Medicare benefits. We're going to provide you with an overview of the hospital. We're going to provide you with a Medicare overview, and then we have plan representatives that are going to give you introductions to their Advantage plan. Hoag. About Hoag. Hoag has two main hospital campuses located in Newport Beach and Irvine. We have 14 urgent care centers and 9 health centers throughout the county. Hoag's medical staff includes more than 1,700 physicians representing 52 different specialties. Hoag includes 5 specialized institutes of excellence. We have neurosciences, cancer, heart and vascular, women's, and orthopedics. Hoag is designated as a magnet hospital as part of the American Nurses Credentialing Center's ANCC Magnet Recognition Program. We're rated as one of the highest ranked hospitals in Orange County for 5 years in a row. Hoag in your community. Our Hoag Health Centers. Hoag is committed to providing healthcare services in communities we serve through our Hoag Health Centers in Aliso Viejo, Costa Mesa, Foothill Ranch, Huntington Beach, Irvine Sand Canyon location, Irvine Woodbridge, Irvine Woodbury, Newport Beach, and Tustin Legacy. Our urgent cares. Hoag Urgent Care provides care 7 days a week for life's unexpected illnesses and injuries. We're located in Aliso Viejo, Foothill Ranch, Huntington Beach, Huntington Harbor, Irvine, Los Olivos location, Irvine Orchard Hills, Irvine Sand Canyon, Irvine Woodbridge, Irvine Woodbury, Newport Beach, Newport Coast, Tustin Legacy, Tustin Ranch, and in summer of 2022, we'll be in Dana Point. Also, we have the Hoag Flywheel Clinic now open at the John Wayne Airport. It's in Terminal B, and it's located in pre-security. Access to primary care. Primary care. You can get primary care through 2 ways, Hoag Medical Group and Hoag Physician Partners, also known as HPP. Hoag Medical Group is primary, urgent care, and specialty physicians. We have over 100 physicians, 21 primary care locations, 14 urgent care locations, and you can find more information online at hoagmedicalgroup.com. Hoag Physician Partners. We have 10 primary care physicians, 350 specialists to service managed care patients, and you can find more information at hoaghealth.org/HPP. Here's a little overview of Hoag Medical Group, we also call HMG. We have, once again, over 100 physicians with specialties in family medicine, internal medicine, pediatrics, geriatrics, sports medicine, allergy and immunology, endocrinology and diabetes, rheumatology, HIV medicine, infectious disease, and palliative medicine. We have locations in Aliso Viejo, Costa Mesa, Fountain Valley, Foothill Ranch, Huntington Beach, Huntington Harbor, Irvine, Laguna Beach, Newport Beach, San Clemente, and Tustin Legacy. Some of the things that we're proud of is our features is we have same-day sick appointments for established patients, and we accept most major HMO, PPO, and Medicare insurance plans. One of the things that you can take comfort in is that your visits will be unrushed, and we take pride in our personalized visits. Hoag Physician Partners, also known as HPP, is our independent physician association. We have 10 primary care physicians, over 350 specialist physicians representing over 50 specialties. Recent additions include Orange Coast Women's Medical Group, where we have over 20 OBGYN physicians at 6 locations providing an integrated care model for women as they move through all stages of their lives. Hoag Gynecologic Oncology, Hoag Urologic Oncology, have access to the Hoag network, including Hoag Health Centers and Hoag Urgent Care. If you need more information, you can call our customer service line at 1-800-369-9247. Right now, I'd like to take this time to introduce you to Jeanette Paterka, who's going to give you an overview of Medicare.
Good morning, everybody. This is Jeanette Paterka. I am a licensed insurance agent, and I am here to talk about Original Medicare today. The senior insurance plans that are accepted by Hoag are Anthem Blue Cross, SCAN, Blue Shield of California, United Healthcare, and Alignment. So to start off the Medicare overview, this is a picture of your Medicare card. The thing to remember about when you need to use your Medicare card is if you're going to enroll into a Medicare prescription drug or health insurance plan, you need to take this card with you, have it available when you fill out the application, because you need to transcribe the information exactly from the card onto the application. So in this example, if you put John Smith and you leave out the middle initial L, it actually can delay the processing of your application. The other item, the item that's changed in the last few years, the Medicare number that you see there on the left-hand side used to be an individual Social Security number, but Medicare came up with the times, and now they have an alphanumeric number, which is now your Medicare number. So you want to make sure you use the number exactly as stated. And then on the bottom, you're going to see Hospital Part A and Medical Part B, and the effective dates of these two parts of Medicare to the right-hand side. So these are very important because when you enroll into a plan, you need to make sure you have both of those effective dates. So what is Medicare? It's health insurance for the following people: if you're 65 or older, or if you're under 65 with certain disabilities. Usually it means you are deemed disabled with Social Security. In any age, if you have end-stage renal disease, so that means you're on kidney dialysis or Lou Gehrig's disease. As I mentioned when we talked about the Medicare card, there's different parts. So what we're looking at here, Part A and B are original Medicare. So Part A covers your hospital care, nursing facilities, hospice care services. It can be the outpatient facility. I like to think of Part A, that portion of Medicare covers the facility charge. So when you go into a facility and receive services. And then Part B covers those services that you receive. So doctor's office visits, outpatient care, home health care. If you need occupational therapy or physical therapy, that's covered under Part B. And then Part C, those are the Medicare Advantage plans. Those are the companies that I mentioned earlier. Those are independent private companies. They have a contract with Medicare to offer benefits to individuals that qualify for Medicare. So an individual can either opt into their Medicare benefits using original Medicare, or they can elect to have a Part C or enroll in a Part C plan and obtain their benefits through that private company. And then Part D, Medicare prescription drug plans. Back in 2006, Medicare added prescription drug coverage. The plans you're going to see today have the Medicare Health and Part D prescription drug baked together, basically. So it's one plan and they're together. But if you have original Medicare or a Medicare supplement, then you also need to purchase a separate Part D, a standalone Part D plan. So you can obtain benefits for Part D either through a health and Part D prescription drug plan together, or you can purchase the Part D separate with original Medicare. There's different parts of Medicare and different ways to obtain those Medicare benefits. So for Part A, which is original Medicare, remember we're talking about original Medicare, most individuals have worked and they receive Part A, they've worked 10 quarters, 40, 10, to receive the premium for Part A, you have to work a number of quarters, and it is 40 quarters. I am totally having a good day today. I've been doing this for 25 years. You'd think I'd do better. Anyway, so Part A, if you've worked and paid into the system, then you receive Part A and there's no premium for that. But Part B, all Medicare beneficiaries must pay their Part B premium. And depending on their income, there's a base level, which we're going to go over, I believe, in the next slide, or you can potentially pay more for your Part B premium. And then Part C, those are the Medicare Advantage plans. Those are the private insurance companies. As you're going to hear today, they can go from zero premium all the way up over, as an example, $100. It just depends on the plan that you enroll into. And then Part D of Medicare, those prescription drug plans, if you opt into a standalone Part D plan, there is potentially a premium for that as well. So this is the Part B income-based premiums for 2022. If you look at that second line, this is based on adjusted gross income, so $91,000 or less, or $182,000 or less. You are going to pay, if that's what your adjusted gross income, the $182,000 or less is if you're a married couple. So single making $91,000 or less, and married couple $182,000 or less. Each individual on Medicare is going to pay in 2022 $170.10. And then, as you can see, if you go down towards the bottom, that scale goes up. So going all the way to the bottom, if an individual makes $500,000 or greater, $500,000 as a single or $750,000 as a married couple, each individual pays $578.30 for their Part B. Okay, and then I had mentioned potentially you can also have a Part D income-based premium. If you're at that top level or at the top line there of income, $91,000 or less or $182,000 or less, you have a zero plan premium for that income-based premium. But if you are one of those higher earner individuals, as you can see on the right-hand side, you do have to pay an additional premium for your Part D prescription drug plan. Enrollment periods. So the scenario that you're looking at here on the screen is if an individual opts into their Medicare benefits when they turn 65 years old. So you have a 7-month window. That window starts 3 months prior to the month of your birth date. On month 4, you can see here in this particular slide, that would be the month of your birth. Your Medicare benefits would start the first of that month, and then you have 3 months after. This is the window that you want to contact Social Security, and you want to let them know that you want to opt into your Medicare benefits. And then they will send you your Medicare card, and you can enroll into a Medicare health plan or prescription drug plan. Okay, the next enrollment period is the annual election period. This is October 15th to December 7th. This is the time that you can change or enroll in a prescription drug plan. You can change your Medicare Advantage plan. You can return to original Medicare, or if you're on original Medicare, you can enroll in a Medicare Advantage plan. It's basically the time of year that you need to take a look at the benefits that you have and determine if that's the same coverage that you want to opt into for the following year. So applications can be accepted by the insurance companies between October 5th to December 7th. And if you submit an application during that time frame, it's going to be effective on January 1st the following year. The next election period is the open enrollment period. This is a newer election period Medicare provided a couple years ago. So if you're enrolled in a Medicare Advantage plan, you have one more additional opportunity to make a change. So you can switch to a different Medicare Advantage plan. You can drop Medicare Advantage plan and return to original Medicare, which is Part A and B, or you can sign up for a standalone Part D plan if you return to original Medicare. This enrollment period is January 1st to March 31st, and the way that the enrollment works is, say you submit an application on January 1st, it's going to be effective the first of the following month, so that would be effective as of February 1st. And then whatever your plan is, as of April 1st, you are going to be in the enrollment period that they call the lock-in period. You must remain on this plan for the remainder of the calendar year, although there are a few circumstances that Medicare will allow you to make a change throughout the year. So special election periods, the most common ones are if you're moving and you move from one service area to another. So Medicare Advantage plans are filed by county with Medicare. So if you live in San Diego County and you're on a specific plan with one of the companies and you move to Orange County, you will have an option. You'll have the option to review the plan benefits for your current plan if they're in that new county, or look at other companies and enroll into one of those plans that's based in your new county of residence. So if you move to a new service area, also, if you enroll in if you're eligible for a Medicare Special Needs Plan, what that means, some of the companies we have here today and others, they have what they call chronic condition plans, special needs plans. So an example of those could be if you have diabetes or if you have heart disease. Some of the insurance companies have a specific plan that is tailored to individuals that have these chronic conditions. So if your doctor can attest that you have one of these conditions, you can enroll throughout the year in one of these special plans. And then full dual beneficiaries. Those are individuals that have Medicare, which is the federal program, and then Medi-Cal, which is the state program for low-income individuals. And then one other enrollment period that you can use throughout the year is if you're LIS. And what that means, low income subsidy. You've qualified for low income subsidy. And I'm going to talk about that in just a moment and explain that in a little more detail. Prescription drug plans, or prescription drugs. So this is the baseline that Medicare requires. So the plans and the insurance companies you hear today, they have to use this as the minimum, but many times their benefits are actually more enhanced and richer than what this baseline is. But in 2022, the first thing you have to do is you pay your deductible. So say if you go into the pharmacy, your prescriptions aren't too expensive, you might be paying 100% of those, say January, February, March, until you pay a total of $480. And then once you pay $480, then you are going to move into the initial coverage limit. So what that means, once you pay $480, between that and $4,430, which is the total drug cost, you are you're going to go ahead and be in this particular phase of prescription drugs. So the way that it works, the calculation is you pay the first $480, then between $480 and $4,430. In this example, if your prescription was $25, you're going to pay potentially a $5 copayment. Your insurance company will pay $20, so the total cost for the drug, the medication, was $25, is going to be deducted and put towards that $4,430. So you're going to move through the year paying your portion, the insurance company pays their portion, and then once you hit the $4,430, you move into a different phase called the coverage gap or the donut hole. It's a temporary change in the way you pay your prescriptions again. So after the total combined drug costs reach $4,430, you are going to, in the coverage gap or donut hole, pay 25% for your generics and 25% for your name brand medications. And then once you have the total combined drug costs into a new phase, it's called the catastrophic phase. Once that hits $7,050, so total combined drug costs between you and your insurance company reach that number, you're going to pay $3.95 or 5% for your generics, or $9.85 or 5% for all other drugs. So low income subsidy, I mentioned this a little bit earlier. This is one of those instances where you can make a plan change throughout the year. So Medicare has a program. You would want to take a look at the Social Security Administration's website, ssa.gov. And there will be a link on there. It says LIS, low income subsidy, or extra help. I invite you, if you're on a fixed income, but maybe you don't qualify for Medi-Cal, which is the low-income state program, I invite you to go into that website, take a look at what the levels are as far as the income, and if you're even close, I would submit an application to see if you possibly can qualify for LIS. If you do, you'll be notified, and you're going to pay $0 to $3.95 for your generics, or $0 to $9.85 for your name brand drugs. Okay, this is a Medigap comparison table, so I'm switching gears a little bit here. So we've been talking about Medicare Advantage plans, which are the private insurance companies. What a Medigap plan is you have original Medicare, so the parts A and B, but that doesn't cover all of your costs. So you can purchase, there is a monthly premium for a Medigap plan, or some people call it Medicare Supplement, so it supplements your original Medicare. There's a couple things to remember about this. So if you take a look over on the right, all the way to where it says N, N is in Nancy at the top of the column, a Plan N is the same no matter which company that you purchase it through. So, say if you are looking at a Plan N and you look at it with United Healthcare or Blue Shield of California, Mutual of Omaha, the benefits are going to be exactly the same. So what you want to take a, to take a look at and focus on is what the premium is, because the Plan N from one company to another can have a different monthly premium. You also want to look at the reputation of the company. You want to go with a reputable company. So these plans can be purchased and they supplement original Medicare. Over to the right-hand side, Plan C and F are only available if your Medicare eligibility date was prior to 2020. So what that means, well, what Medicare does is from time to time, they actually reorganize or restructure their plans, and they did so not too long ago. So if an individual, the way you would look at this, say if you were working and you had your employer group coverage and you didn't opt into Medicare when you turned 65. So say if you turned 65 in 2018, but you kept working up until 2021, and in 2021 you said, you know what, I'm going to go ahead and I'm going to retire from my employer plan. My employment. I'm going to lose my employer plan. I'm going to opt into Medicare. The fact that you could have enrolled in CNF prior to 2020, you were eligible for Medicare prior to 2020, you could then at that time enroll in either one of these Medicare Medigap plans, C or F. So with that, we're going to have our insurance representatives come in one at a time, and they're going to review the benefits of their plan. If you take a look, if you scroll down in your YouTube screen, you will see a link, and you will see the presentation as well as a grid that you can fill out and go along with what the benefits that they say. So AARP Medicare Solutions was not able to be with us today. So Rosalie is the representative that presents. You can see her telephone number and her email address there. So if you have questions specific to AARP Medicare by United Healthcare, please contact Rosalie directly. So with that, I am going to introduce Diana No. She's an independent agent. She's representing Blue Shield of California. Thank you.
Good morning, everyone. My name is Diana No. As Jeanette mentioned, I am an independent agent or broker, and for today, I will be representing Blue Shield of California. So a little bit about Blue Shield. They are a not-for-profit company based here in California. They've been in the healthcare industry for over 80 years. They offer a variety of products such as Medicare Supplement, Medicare Advantage, as well as prescription drug plans. So what does that mean to you? They're a one-stop shop. They'll have a plan that will fit your budget and your needs. So for today, I'll be reviewing one of their leading plans in Orange County, which is a Medicare Advantage plan, and it is called Blue Shield Inspire. On the screen here, you will see a copy of the benefit highlights. If you'd like a copy of this electronically, you're welcome to contact me, and I can certainly email you this copy as well. However, for today's presentation, I will be going over, as Jeanette mentioned, the comparison grid that you can find in the description box. So highlights here, but for the presentation, it'll be a little bit more detailed, okay? As I mentioned, this plan is called Blue Shield Inspire, and it's for LA and Orange County. The star rating for this plan is a 4. There's no additional premium for this plan besides what you pay for your Part B premium. So you pay your monthly premium for Part B, you join this plan, there's no additional premium. As for your primary care and your specialty visits, so if you need to see a cardiologist, ophthalmologist, endocrinologist, anything ologist related, it is a 0 copay. This plan does have a maximum out-of-pocket of $799. What does that mean? This is the most you pay out-of-pocket for your medical expenses if you needed to, so for hospital and medical. I'll be going over some co-payments, and those co-payments will go towards your maximum out-of-pocket. So for example, if you were admitted to the hospital, it is a 0 co-payment. Let's say you needed to go to the emergency room, it is an $85 co-payment. So that $85 co-payment would go towards your maximum out-of-pocket of $799 for the year. However, if you are admitted to the hospital from the emergency room, your copayment is waived. Also, this plan includes worldwide coverage. What does that mean? Since things are opening up a little bit more now, and if you're traveling domestically or internationally, you are covered for emergency and urgent care services. You do have the $85 copayment, but you are covered for emergent and urgent services outside of the county, so domestically and internationally. As for the ambulance, if you need to call the ambulance to pick you up, it's a $100 copay per trip. As for outpatient surgery, so let's say you need a cataract surgery, the not so fun colonoscopy. If you had the procedure done at an ambulatory surgical center, it is a zero copay. However, if you are someone that might be high risk, your doctor might say, you know what, to take extra precaution, we want you to have the procedure done at the outpatient hospital facility. So this is typically on the hospital campus. You will be paying $150 copayment for on-site hospital facility. Let's say you had a procedure done and you're well enough to be discharged from the hospital, but you might need extra rehab services, extra care, not 100% well enough to go home completely. You may be discharged to what's called skilled nursing or nursing home. Sometimes people use that interchangeably. So skilled nursing. So the first 20 days, if you were at a skilled nursing facility, you're paying a zero copay. So for the first 20 days. However, if you had to stay there a little bit longer, maybe from days 21 through 100, you do pay a $50 copayment per day if you're there from days 21 through 100. So you might ask me, Diana, if I end up staying there 100 days, am I responsible for $4,000? The answer is yes and no. You are responsible for what I mentioned earlier, the maximum out-of-pocket of $799. Once you pay that for the year, then your medical expenses are at zero cost, right? Moving along the next few items, there's going to be a lot of zeros. So we have your x-rays, your labs, MRI, CT, PET scans, diagnostic testing, if you needed physical therapy, occupational therapy, speech therapy, as well as urgent care services, is all zero. You pay zero for those services. Now moving on to our prescription drug coverage, Blue Shield has a very robust formulary, so list of medications covered. So oftentimes you may see medications covered on our plan, and you won't see it on other plans. So I will be giving you the co-payments for the prescription drugs for the preferred pharmacy. So there's two types of pharmacies. There's preferred, meaning you have better cost sharing if you go to the preferred locations. So we're looking at the CVS, the Costco's, Walmart, some of the grocery locations like Save-Ons or Albertsons, Ralph's. So if you have your medications filled at these preferred pharmacies, you pay the preferred rates. You're still welcome to go to the standard locations, but your share of costs will be a little bit higher. So for Tier 1 at the preferred pharmacy, these are your preferred generics. It'll be a zero copayment for a 30-day as well as 90-day supply. Then there's Tier 2, which is our typical generics. You're paying $3 or $4.50 for a 90-day supply. Tier 3, these are your brand name medications. Typically, you find insulin, Eliquis, Jardiance, Trulicity, those type of medications. So for a 30-day supply, you're paying a $35 copayment, and for 90 days is $87.50. As for Tier 4, these are the non-preferred brands. You're paying $95 for a 30-day supply and $237.50 for a 90-day supply. And lastly, Tier 5. This is typically your injectables. If you're taking chemotherapy medications that are filled at the pharmacy, so not at the hospital or at an infusion center. So this is if you were given a prescription and you go to the pharmacy to fill up your prescription for chemotherapy medications, injectables, things of that sort, it'll be a 33% coinsurance. This plan does not have a Tier 6, so you can disregard that. Moving on to dental coverage, this plan also does offer basic dental coverage. It is an HMO network, so you do have to use the doctors that participate in the dental plan. However, if you're someone that likes flexibility, you have a dentist that may not be in a network, there is an option to upgrade for the dental PPO plan. So there is an additional fee for that, but you do have the option for upgrade. As for hearing aids, so this plan does cover hearing exams at a zero cost, but let's say it's determined that you need a hearing aid. There are two options for this plan. You have the Silver technology, which is $499 per ear for hearing aid. or the Gold technology, which is $699 per ear. Hearing aids are offered through a vendor called Epic Hearing, so they are contracted with multiple audiologists in the area. If you're not familiar with how much hearing aids costs retail-wise, even going to Costco, buying the low-end one is running about $1,000, $1,500 per ear. So quite cost savings on this plan. As for your vision, so if you need to get your eyes checked, so this is different from your ophthalmologist. So this is different from your cataract and your glaucoma type of screenings, right? That would be for your ophthalmologist, which is under your medical. This vision coverage here is for your glasses or contact lenses. Zero copay for your exam, and you get a $200 allowance for your frames or contact lenses. And the administrator for this plan is through VSP. So you may have heard VSP in the past when you were working, so that's the vision administrator. So many local optometrists are contracted with VSP. As for your health club membership, this is also included in this plan. If you're familiar with the company Silver Sneakers, they are contracted with multiple gyms in the area. So you have the LA Fitness, 24-Hour Fitness, YMCA. As long as you're in this plan, you have access to those gyms. And you can belong to multiple gyms if you choose to, right? If you are someone that likes to work out late, like myself, I'm a night owl, I would probably want to go 24-Hour Fitness because they have extended hours. But maybe you like the equipment or the pool or the sauna at LA Fitness. You can also belong to LA Fitness. So you're not limited to just one gym. And that is through Silver Sneakers. Moving along to transportation. This plan also includes transportation at no cost to you. You receive 32 one-way trips. So if you need a ride to the doctor, the lab, urgent care, etc., call the Blue Shield service and they can schedule a ride to the doctor for you. Now moving on to the extras that aren't on this grid here. This plan also includes over-the-counter coverage. What does that mean? You have an allowance of $100 per quarter to buy everyday type of items like toothpaste, ibuprofen, cotton swabs, vitamins. You have $100, easy peasy to order. All you have to do is either call in to the service center or order online. You have $100 to spend per quarter, and these items are shipped to your home at no cost. This plan also includes the personal emergency response system. So this is the medical alert device at no cost to you as well. It is through a company through LifeStation, and dependent on your lifestyle, your activity level, when you call in to redeem the benefit, you can either get the traditional bracelet, pendant, or the GPS mobile device if you're a little bit more active. For my folks that like alternative medicine services like acupuncture, chiropractic services, this plan also includes those services. You receive 24 visits for acupuncture and 24 visits for chiropractic services at zero cost. You do have to use a network called American Specialty Health. So there's a group of chiropractic and acupuncturists that are part of that network. You see one of those providers, and it's a zero cost for you to get those services done. And lastly, something new that Blue Shield added this year, home delivered meals. So for my folks that, let's say you go to the hospital or skilled nursing and you're discharged to come home. You're probably not 100% yourself quite yet, and you may not have time to meal prep or go back to your daily routine. This plan includes home delivered meals at no cost to you. So per discharge, you will receive 22 meals as well as 10 snacks. So definitely a great benefit that they've added on this year. That concludes my portion here. So as I mentioned, Blue Shield is a one-stop shop. So I went over the Medicare Advantage plan, but we do also offer Medicare Supplement at very competitive rates for our Plan G as well as G Extra. We also include prescription drug coverage. So if you have any questions about your plan options, whether it's a Medicare Advantage plan, Medicare Supplement, or prescription drug plan, you're welcome to contact me. My number is, you see on the screen, it is 949-226-4064. You're welcome to contact me, and I'd be happy to send you additional information if you'd like. That concludes my portion. So now I am going to introduce our next speaker, and this is Joanne Bidet with Scan Health Plan. Thank you, and have a great day.
Hello, so happy to meet all of you this morning. My name is Joanne Boudet. I'm with Scan Health Plan. Scan Health Plan is a not-for-profit organization. We only enroll Medicare recipients. So if you have Medicare A and B, or you're planning to get your Medicare A and B, we're the plan for you. SCAN has over 260,000 members, and we are here locally here in Long Beach. So if you call up member service, you're going to get somebody here in our Long Beach office. But better yet, if you enroll with me, you get me all year long to help you with your questions, any concerns you may have. You can call me directly on my cell phone number, and that number is 714-272-8983. And that's Joanne Boudet with Scan Health Plan. Let's see, there we go. I wanted you to see my picture. Okay, so 714-272-8983. So SCAN offers multiple plans. We have plans designed for people who are diabetic, where our insulin is actually a zero copay, which is totally unheard of in this industry. We also offer plans that are designed for people on low income, and we have plans that are designed for everybody that has just Medicare A and B and they live in the service area. Our most popular plan is our Classic plan, and that's the one I'm going to go over today. Our Classic plan has a star rating of 4.5 stars, which is we've had for 5 consecutive years. We're very proud of that. Premium is 0. Primary care doctor and specialist is 0. Our maximum out of pocket, $499. That's less than $500 that you may have to spend out of your own pocket for any medical care due to coverage under Part A and Part B. That is very, very low. Okay, so that's an important number to think about if you are going to have some treatments, mostly like chemotherapy and things like that. So $499. Hospital copay is 0. Emergency room is $90. However, it is waived if you are hospitalized due to the emergency. Ambulance, $100. Outpatient surgery is 0, whether it's done at the hospital or the surgical center, it doesn't matter. Skilled nursing facility is also 0. And there's no limit to the days except for set by Medicare, which is 100 days per benefit period. And if you have questions about that, I'm happy to go over that. Just give me a call. X-rays and labs are going to be 0. MRI, CT scans are also 0. Diagnostic testing is $50. So it's pretty hard to even hit the $499 maximum out of pocket, considering all of our copays are at 0. Urgent care is also a 0 copay, and that would be urgent care and emergency is covered worldwide. So you're covered here at home, you're covered out of the state, and even out of the country for emergencies and urgencies. Prescriptions, we cover you for medications 3 different ways. You can go to a preferred pharmacy, which would be like CVS and Rite Aid, Costco, Albertsons, and then you can use a standard pharmacy, which would be your Walgreens, Medicine Shop, and a lot of smaller mom and pop pharmacies. If you go to a standard pharmacy, you will pay a little bit more with the copays for your prescriptions, so I recommend you use the preferred pharmacies. Also included with the preferred pharmacies is our mail order service. Mail order for prescriptions, you would get a 3-month supply automatically, as long as it's legal to send 3 months through the mail, and that medication would automatically renew and just show up right in your mailbox. Our company is called Express Scripts, and they're very easy to work with. So what I'm going to do is go over the medications. We have 5 different tiers of medication. The higher the tier, of course, the more expensive the medicine is, and that means your copay may be a little bit higher. So I'm going to go over the 5 tiers. I'm going to quote you the prices for a 30-day and then a 3-month supply, which, by the way, can be all the way up to 100 days. I'm going to quote you that with preferred pharmacy or mail order. So if you go into a preferred pharmacy and your medication is under Tier 1, it's going to be a 0 copay, no matter how many days you get. Tier 2 is also going to be 0 copay. Doesn't matter if you get 100 days, you're still going to be a 0 copay. Tier 3 is a $30 copay for your brand name medications, and we give you a $20 discount if you get a 3-month supply, and that would be $70. And Tier 4 is $95. These are the ones that are really expensive. They're advertised on television, and they cost quite a bit. It's $95 for 1 month, and then you would pay $265. That includes that $20 discount, and that would be for 3 months supply. And then Tier 5 is a specialty drug. It's a 33% copay. There's a few medications under there for MS and a few other things that I've run across that could be a 33% copay. And we do not have a Tier 6. Dental coverage. SCAN covers you for dental at no charge. Now, Medicare doesn't cover dental, so we shopped really hard, found a really good plan that we felt that would give big discounts with no limits of coverage, and it's through Delta Dental. We have a list of thousands of dentists right here in Orange County that will take the plan. I can go over that with you. I can show you how to look up those dentists for you. Just give me a call. We cover you for your cleanings and your x-rays and your visits twice a year. And then even if you needed a deep cleaning, that's also covered. All of that is at a $0 copay. And then discounts on things like root canals and fillings and crowns and bridges and things like that. Anywhere from a 30 to 60% discount on all of those. And like I said, there's no limit to the coverage you get per year. Hearing aids, we use a company called True Hearing. They offer you a hearing exam every year at no charge. And if you do need a hearing aid, you would get them highly discounted. Normally, their hearing aids run around $2,000 to $4,000 per hearing aid. You would only pay $450 to $750. Okay, that's $450 to $750. Great program. Your vision is iMed, EYEMED. They are with Lens Crafters. They're with Target Optical. You can go to Walmart Optical. They're also with many, many small independent optometry offices. And then that new one that we see advertised on TV, it's called America's Best. You see it with the owl on the commercial. That's where I got mine. So we cover you for glasses every 2 years or contact lenses. And our allowance for that would be $250. So if you spend more than $250 because the eyeglasses make you look 10 years younger, well, then you're going to pay the difference, but we'll pay the first $250. Okay. Health Club membership is Silver Sneakers. Okay. Silver Sneakers is a great program because you can get programs through them online. You can do exercise programs at home. You can do walking programs with them. You can put together a walking program through them. So it's really a great opportunity to use Silver Sneakers. And then transportation. We cover you for 32 rides a year, and that would be to and from the doctors, the x-rays, the lab, the pharmacy, even the dental office. Okay. Extras, we have lots of extras, okay? We have over-the-counter items where you can spend $50 in our catalog, and you can get vitamins, minerals, Band-Aids. There's even electric toothbrush in that catalog. There's bath mats, all kinds of different things. You order directly from the catalog, and then we mail you the items at home, and there's no charge for shipping. That's $50 per quarter. And if you don't spend it in the first quarter, then it rolls over to the next and keeps rolling over all the way into the end of the year. But if you don't spend it by the end of December, it does start over in January. We also cover you for a Fitbit. So we have like a system going. We want you to go to the gym. We want you to walk with your Fitbit. A Fitbit is like a watch that you wear, and it counts your steps. And then we also have a program that you can play on your phone, and your smartphone, or on your laptop or iPad, where it's called Brain HQ, and it's to exercise your brain. So we want to keep you moving and keep you active. We have telehealth. Telehealth is where you can call a board-certified physician on the telephone 24 hours a day, 7 days a week, anywhere here in the United States. That doctor is able to assess your medical condition on the phone, and if possible, like maybe it's a sinus infection or something like that, they can order your prescriptions to your local pharmacy, or even if you're visiting in New York and you need to get a prescription in New York, they can take care of it there for you. and there's no charge for that, and there's no limit to how many times you use that doctor. So the telehealth is really a great opportunity. Instead of going into urgent care, now you just can talk to the doctor on the phone. They'll do a virtual call on FaceTime with you if you need to, or even on your laptop. A Zoom call similar to what we're doing today. Chiropractor acupuncture is covered. Routine visits to the podiatrist just for nail clipping and callus removal is also covered. We have emergency response system where that advertisement where the woman says, "Help, I fell, I can't get up." That is also covered for our members who are in need of that. And then the one that's my very favorite, it's called Returning to Home. So if you go into the hospital and you come home from the hospital and you're weak and you're tired, or you're still worn out from your illness, maybe you have an incision and you try to do your normal things at home that you do every day, you may end up back in the hospital. So instead you call SCAN, we'll send somebody out to the house. We'll help you take a bath, get dressed, do some light housekeeping, do the laundry, change the linens on the bed. Quite a bit is going on. There's no charge for that. We give you 40 hours in a 4-hour increments, and we also will send food to the house after a hospital stay. So up to 28 days of the food, that's 84 meals. Okay, it's just phenomenal. So as a SCAN member, like I said, you get a great member service department. We have a 91% satisfaction with Medicare rating as far as our member service goes. They answer their phone from 8 in the morning to 8 o'clock at night. Starting on right now, it's 7 days a week, and starting April 1st, they'll go back to 5 days a week. You have me to call throughout the year. I've been doing this for over 25 years, and so if I don't know the answer to a question, which I usually do, then at least you know that I can find the answer for you. So I think that's it. I would love to have you give me a call. I would love to go over these benefits with you. I can send them to you on the phone. We can do a Zoom call. I can meet you face to face, whatever works best for you. But just give me a call. I'm at 714-272-8983. 714-272-8983, and I'm Joanne Boudet with Scan Health Plan. Next coming up is Fernando. He's coming from Alignment Health Plan, and he's going to discuss his benefits. Have a great afternoon.
Thank you, Hope, for having us here today. My name is Fernando Galindo. I am a Territory Sales Manager with Alignment Health Plan. The product I'm going to be presenting today is the Preferred Provider Organization, which is also known as a PPO. It's product AVA PPO Plan 008 in Orange County. This is an exclusive Hogue Network program. Alignment Health Plan is a 4-star rated health plan. We have a very big network. And the plan that we're going to be doing right now is the PPO in-network and out-of-network. I'll be going over the benefits. It is a $22 premium for the in-network. It is a primary care doctor's visits, $5 copay. A specialist visit is $20 copays in-network. Out-of-network would be $40. Out-of-network would be $50. Maximum out-of-pocket is $3,900 within the network. Out-of-network is $9,500 combined. Does not include your RX. Hospital copay for in-network is $150 per day for the first 3 days. Days 4 through 90 are 0 and unlimited after that. Out-of-network is 20%. Emergency room copay is an $85 copay within the network. Out-of-network is the same. Ambulance copay is $250 for air and ground within the network. Out-of-network is 30%. Outpatient surgery is $165 for hospital and $100 for ambulatory surgical center for in-network. Out-of-network for the hospital outpatient surgery is 25%, and the ambulatory surgical center would be 30%. Skilled nursing facilities for in-network are days 1 through 20, 0, and days 21 through 51 are 100 per day. Out-of-network would be 30%. X-rays, laboratories, X-rays would be $15, laboratories would be 0 within the network, out-of-network would be 30%. MRIs are $150, and as well for CT scans within the network, out-of-network would be a 30%. Diagnostic treating would be a 0% within network, out-of-network would be 30. Physical therapy within network is a 0 copay, out-of-network would be 30. Urgent care within network is a $20 copay, out-of-network is $20, waived if admitted in the hospital. Prescription coverage, Tier 1 prescription coverage is a 0 copay. Tier 2 prescription coverage is a $5 copay. Tier 3 is a $40 copay. Tier 4 is a $100 copay. Tier 5 is a 33%. And Tier 6 is either a $5 copay for a 30-day supply, or if it's 100-day supplies, it's a 0. We do not have a preferred provider pharmacy. You can go to any of our contracted private pharmacies, which is great. We also have vision benefit. You have your yearly eye exam for free, and you have a $150 allowance for glasses every 2 years, and that's through VSP. We have health club membership that's included through Peer Fit Move. And we also have the Options Plus package. The Options Plus package has a $62 premium, and the Option Plus package includes dental coverage, which is your Delta Dental PPO. It's a $1,500 coverage per year. You also have hearing allowance, your yearly hearing exam, and a $2,000 allowance towards hearing aids every 2 years. Have transportation available, that's 12 one-way trips. You also have PERS, which is the Personal Emergency Response System that's available. And you have an extra $15,000 worldwide emergency coverage. The PPO plan is one of the great alternatives for people who are considering either supplemental plans. PPO offers flexibility and freedom at a lower cost. The premium is a $22. Our Option Plus package is $62, totals out to $84 a month. There's no underwriting for for this plan. The freedom to see any doctors out of network, no referrals or specialists. So this could make sense for someone looking into a supplemental plan. This is an alternative for a supplemental plan. Again, it's a PPO plan through Alignment Health Plan. My name is Fernando with Alignment Health Plan. I'm a territory sales manager. My phone number is 562-577-8814. Thank you for having us here today. I will pass this over to Jennifer Turner. She'll be presenting Anthem. Thank you.
Hi there. Last but not least, my name is Jennifer Turner, and I am a local independent health insurance broker. I'm going to talk about Anthem today. So let's go ahead and show you this. I know you guys have a paper to fill out, so let me go over what makes Anthem's Medicare Select Plan unique. Star rating, we're a 3.5 star rating. Premium is 0. Primary care and specialist visits are 0. Your max out of pocket is $900. Copay for hospital is 0. Your emergency room copay is $90. Then we've got the ambulance copay, whether it's land or air, it's $200. Outpatient surgery copay is 0. Skilled nursing facilities is for 20 days, you have 0 charge, and then for 21 days to 100 is $75 a day. Then we've got the labs and the MRIs and the CT scans are 0. Diagnostic testing is also 0. Physical therapy is 0. Urgent care is 0. And then we've got our our prescription drug tiers. The cost for that is 0 for tier 1 and $5 for tier 2. For tier 3 is $42. For tier 4 is $95. And then tier 5 is 33%. And then tier 6 would be $0. So let's go into some of the extra benefits that we offer. We're going to put asterisks around some of them. So dental coverage, we do have embedded preventative care, but we're going to put an asterisk by that because I'm going to come back to it. Hearing aids is one of the highest coverage. We give you $3,000 for your hearing aids, but we're also going to put an asterisk on that one. Then we've got vision as well. They give you a $150 allowance for vision for glasses. You have the health club membership with the silver sneakers, so you could go to the gym or to the pool if you'd like. Transportation, we're also going to put an asterisk by this. We get 12 embedded rides, one-way rides on the plan, but we'll come back to that. And then they also have over-the-counter allowance, and that is $80 quarterly. So that means that in the total year, you'll get $320 that you can use for over-the-counter drugs. So with the Anthem Medicare Advantage plan, you can choose 2 of these 9 extra essential extras, and it's at no cost to you, which is great. So let's go over those. The first one is assistive devices. So whatever you may need, handrails, shower stools, raised toilets, etc., that could be something that you can get. The next one would be health and fitness tracker, like a Fitbit. If you like to stay active, that helps you know, so that's something that you can get. They do have the option for pest control. If your doctor feels that the reason you're ill is because of your house needing to be treated, that's something that Anthem would cover for you. Here's that asterisk that we talked about, transportation. You can pick the transportation option, and you get 60 one-way rides. So that's a lot more than the 12 that they gave you just regular in the package. So that's an option if you have difficulties with getting transportation. They also have in-home service, and what in-home service is that you can have somebody come and just help you with your daily activities and it's 60 hours worth in a year, so you can break that down. And they come and just hang out with you, be a companion, watch TV shows with you if you'd like, or play games or what have you, just activities of regular daily living. And if you require a little bit more than that, then we have personal home helper, and this provides up to 31 visits, up to 4 hours each visit of home health, and that's helping you with your everyday daily activities, whether that's getting dressed, whether that's helping you shop or cook. So that when you require a little bit more help, then this is the program that you would want. They can actually help you bathe and get dressed as well and provide some meal prep for you. The next thing on the list there is a flex card, and this is why we put the asterisk on the dental, vision, and hearing. This flex card allows you to have $500 extra a year that you can use on either dental, hearing, or vision. Okay, so if you know that you're going to need some dental work, then this would be a good card for you so that you can pay for that extra service that you need to have done, or if you know that you're going to need some glasses and maybe some contacts as well, or you would like to get some sunglasses that are prescription, that would be a good option for you. The next one is healthy meals. And healthy meals is so that you can enjoy some healthy meals delivered directly to your home. So if you, are not cooking for yourself or can't cook for yourself, then this is a good option. And they'll bring you 2 meals a day up to 90 days. So that's a good choice if you need that. And then the last thing that we have is the healthy groceries. And healthy groceries is another card that we give you that gives you up to $50 worth of groceries at a store. And there's a lot of stores that are part of it. But it's all for you to buy healthy things, which means you'd buy fruit and vegetables and meat, potatoes. Can't get the candy or the liquor, but you can get the good things that are for you. So those are ways that we want to keep our clients just active and healthy so that we give them all these options. So with this plan here, you will be able to pick 2 of those for free as part of your plan. So as you can see on the flyer there, my name is Jennifer Turner, and my phone number is 714-345-9097, and I'm representing Anthem, so give me a call if you have any questions. I am passing it on now to Henry.
All right, I'm back. Wow, a lot of great information. First off, I just want to thank all of you for taking time out of this morning to come and watch our webinar and learn a little bit more about some of your Medicare benefits and some of the options and features of the health plans. Once again, it's a lot of information. We know if you look on our YouTube site, you'll see the links to the presentation and the different features and benefits sheet that we have that's attached there. Once again, we just want to thank you. Have a great weekend. Stay warm, and we'll see you soon. Bye-bye.